So good morning all and good afternoon those who are on the eastern side. I'll be presenting the part B of today's seminar, structured approach to rural transportation integration. I'm Abhay Lidbe, assistant research professor at the University of Alabama. What I'm going to present today is it's a part of the project that was awarded to me through the research exploratory grant the project is called as Drive Smart, that's developing regional integration for vital experiences by strengthening mobility access and regional transit. The core idea for this project is simple. It's more like we have several isolated transit services or transportation services in any given region. The idea behind this project is how can we integrate this system into one single, mobility ecosystem, region-wide ecosystem. And I would like to thank and also acknowledge the CR2C2 Center and its leadership team for giving me this opportunity to work on this project. Uh, so, oh, okay, this just give me a minute. I think. That was the. So we know the challenges with the rural transportation. These are some of the statistics here. 97% of the land area and with significant number of road miles in the rural region, and still only less than 20% of the population lives there in the rural area in the US. What does this mean is, I mean, you can just, with the statistics in mind, you can kind of imagine the how transportation can be logistically challenging in the rural communities. And then here's a map of US. There's something called as rural urban continuum codes. So it divides the region based on the population and the urbanity or rurality of the region. So it's on the scale of 1 to 9. The 1 essentially is the like metro area, very highly populated. 9 is highly rural area with very rural population. From this map, you can see how the rural areas in this country are spreaded and how does it looks like. Now, from this report, you can also see that like significant number of the amount of the population in the rural areas are either older, that's 65 plus, and are they disabled, or many of them are also under poverty line, right? So again, some few more statistics. There's about 2,000 plus public transit services in the nation, but more than 50% of that operate in rural areas. There are 40% counties which lack public transit altogether. The average trip time is longer than in the urban areas. And then for many, especially for the older population, they have vision problems, they have mobility problems, cognitive decline. So sometimes, and for many of these rural population, driving isn't a choice, it's just a barrier. And then on top of that, there are single moms and single moms, people with disabilities, chronically ill people, and they're often kind of trapped without any transportation options. And so for them, the transit is the only option which can take them to the places. So it's not about the convenience for them, but it's more a matter of survival. And then these are some of the stats at the national level, and you can clearly see all the ridership and the vehicle revenue miles and the revenue hours. I mean, that's more than twice of for the urban area. Despite that, that the population is only less than 20% in the rural areas. So you can imagine the need for transportation options in the rural region. And some another statistics here. Again, when it comes from the operator's perspective, I mean, there are two main types of services, fixed route and demand responsive. Demand responsive are typically operate in the rural areas. But if you look at the cost per vehicle revenue or vehicle revenue miles or vehicle revenue hours, fixed routes are kind of expensive on that front, but overall the total trip cost is smaller, whereas the total trip cost for demand responsive is significantly higher, more than twice of what it is. And the point of showing this is the amount of the funding load that the rural transit agencies have to take on them. And again, some national level statistics, the FTA, 10 FTA regions, we all here belong to region 4. And you can clearly see we are, in terms of number of agencies or riderships, everything, all those fronts, we are one of the, we are the highest in almost all of them. And also you can see the operating expense per trip is also, it's not the highest, but we are second highest. It's also kind of high compared to other regions in this area. Again, some of the challenges we all know: long distances, population density, limited transit options. But on top of that, there are several agencies which also face like kind of staffing problems. There are infrastructure problems. Most of the rural places have only 2-lane rural roads, and with no curbs, side, no shoulders, becomes difficult to load, unload the passengers into the van. And more than that, because rural transit agencies have to serve larger areas, it costs them a lot. As it is, the operating cost is also higher. So funding is always limited. So just out of curiosity, I was looking at the section 5311 formula grant distribution, and you can see there's the funds are appropriated, and then there are appropriation of like almost 10% of those funds, and then the balance comes to the state. And out of this balance, whatever the significant portion here, which is 83.15%, 80% of that is based on the population, and then a small chunk is based on vehicle revenue miles. So essentially, according to me, it has to be other way around, because the population in the rural community is less. So even if it's a higher component, only small amount of funding comes through this channel, whereas the revenue or the mileage is the significant cost component for most of these operators, but that has a pretty low weightage. And probably that's one of the challenges that the rural transit operators face, the funding. So because of this, most often these transit agencies gets into a circular dependency. That means if they want to offer more service, they would need more funding. But if in order to offer more funding, they have to offer more service. So it's kind of chicken and egg situation that they land into, and which they are not able to break in time. And that's why there's always limited options, which are they stick with the already existing option. Then not on so in addition to the transit services, public transit services, there are so many other departments like the Department of Agriculture, Health and Human Services, Medicare, Medicaid services. They also have their transportation services they also operate the transportation services in the rural community. But the challenge again here is most of them operate in silos, operate just cater to their own customer segments. And now there's something called as Coordination Council for Accessibility and Mobility, and they propose an interagency coordination is one of the way to improve the efficiency of rural transit. improve the accessibility and availability of the river transportation for the rural communities. However, the challenge is the report also says that most of the local agencies lack the awareness of these options. It really doesn't trickle down to the local economy. And that's essentially a kind of challenge that we are trying to tackle. So our solution to that is basically this project. You can see we have the public transportation, urban transportation, rural transportation, the private operators, are like diverse stakeholders in this project, which we are trying to work with each other and try to, address some of the challenges that this rural communities face. So, and how do we, so the motivation, again, I think you might have seen this slide sometimes in the back in my previous presentation. But that's the West Alabama region. It consists of 8 counties. The blue dots are the one here. Typically, those are typically the transit destinations, and then those dots on the map, which dot represents 5 senior or disabled or low-income household. And this has been a kind of ongoing issue for a long time in Alabama. It's being reported in the regional plans, and the regional commission is looking for ways to overcome some of these challenges, looking for some innovative ideas to improve the transit services in this state. So and that's just our study area, the 8 counties in the West Alabama region. What you see here on the slide is just an example of some of the transportation services that are offered in the West Alabama region. You can see in which areas or which counties they operate. You can also see the numbers there, which are nothing but the formula grant numbers through which these services are funded. And you can also see the kind of the programs that they the segment that they service. Again, the challenge is each of these services operate within their own silo, and there's a lot of duplication, a lot of inefficiency, a lot of gaps in the services, which we are trying to address. And what we are trying to do here is anything new. So this is PCRC report 101, which was published in early 2000. That also mentions about the coordination strategy. And that's what we are trying to establish through this project in this activity. So in a simple terms, coordination is nothing but doing better with existing resources by sharing resources. Share funding, share management, share responsibilities, share vehicles, so that duplicated efforts are eliminated and more opportunities are created and the efficiencies are improved. So there are 29 case studies which are presented in this report. So we kind of synthesized this whole report and came up with these 4 basic models from this report. So those are nothing but cooperation, which essentially means multiple agencies just cooperate and collaborate, but they still operate independently. They just coordinate their trips. Mobility management is more of, again, a collaboration, not only amongst the public transit, but all other options like non-profits or volunteers or any other private operation. And brokerage is essentially a centralized agency or a person who kind of receives trip, and then he's the one who takes the decision to allocate the trips to different service providers. And then there's a consolidation, which is more like all the agencies or all the operators merge together into a single organization or agency, either physically or it can be virtually by having some integrated system by all of them. And also based on these different service models, we came up with four key strategies: the shared vehicle, shared dispatching, flexible routing, and volunteer. And this is all after synthesizing the 29 case studies that are presented in this report. So now the question here is, while we have different service models and then we have different strategies here, what do we do about it, right? Which one is more suitable for us? Which one should we be picking? That's the question we are trying to answer through this question. But before that, just wanted to note that transit coordination is not a simple kind of an optimization problem. It's a multi-stakeholder, multi-criteria thing. Because there are just too many different agencies with too many different goals, present involved in this journey, like for the coordination efforts. Also, the goals, for example, the user goals typically never match with the service providers' goals. Service providers' goals are very measurable in terms of cost or travel time, fleet utilization, how much of ride actually, that's what their goals are. Whereas the users' goals are subjective, more on trust, easiness, comfort, acceptable or not. So overall, it generates kind of conflicting goals, as it is the resources are limited, and hence there has to be some trade-off. But then, what is the best solution with this multi-stakeholder, multi-criteria, and multiple trade-off? That's what we are trying to address through this project. And to do that, we rely on the analytic hierarchical process, also called as AHP, very widely used in 19s and even early 2000s. There's still a lot of research going on using AHP. Here's one of them. It has a lot of applications in solving transportation problems as well. Is one of the paper which does the systematic review of AHP application in transportation problem. And based on these and the key strategies and that we identified, this is the AHP framework that we developed for our project. Okay, and the input for this came through surveys, and we surveyed community members, essentially the users of the transportation services, and then we also surveyed separately the agencies. We got 214 responses from the users and 8 responses from the agencies. So essentially 8 agencies responded to this. Let's go in detail on how this works. So here our central goal for this project is how to develop a coordinated transportation system, right? And after doing that, then we started thinking about the 4 A's of transportation access: availability, affordability, accommodation, access. So we call this as one criteria. The questions that were asked for this criteria were answered by both the agencies as well as the AD. And we developed some surveys in Qualtrics as well as Microsoft Forms. We simplified the terminology instead of calling it as availability, affordability. We use simple terms that the general audience can understand. We clearly define what it means. Okay, and then we used kind of pairwise comparison. Pairwise comparison is an advantage because if you ask what is important, typically you will see, oh, everything is important. But when you do the pairwise comparison, you are forced to kind of think, oh, really, oh, is it availability and accommodation or accommodation more than acceptance? So that way we get like very objective responses. After doing that, then we had a level 2 sub-criteria. So for availability, what does availability mean? And then we had sub-criteria for that, and same for affordability and other aids too. So, and these range from all like the service area coverage, to the cost, or to the delays, or to the comfortness of the service. So there were in all 12 different sub-criteria that we used. For this purpose, we just relied on the normal scale of 5, ranging from very important to very unimportant for each of these two strategies. And then at the bottom level, that's level 3, these are the alternatives or strategies. And these are the strategies which the agencies will offer or would prefer to offer. Okay, and these are the same strategies that we developed based on that, the TCRP synthesis. Okay, and the response to these strategies were given only by the agencies because they are the one who are going to decide on what is the best option that we get. Right? So for this, again, we simplified the terminology, we explained the agency, like the providers, what it means and what it will do. And then we again relied on pairwise comparison. So for the 4 strategies, there were 6 combinations of the pairwise comparisons, and then the same set of 6 pairwise comparisons were asked for each of those 12 sub-categories. But there are still some challenges with the AHP. For example, let's say in this case, we are looking at 4 criteria, which gives us like 6 pairwise comparisons. Okay. Typically, the standard AHP scaling range from 1 to 9. For simplicity, we just use scale of 1 to 5. And you can see the corresponding HP value. If X is extremely important and Y, then it's 5. But if it's other way around, then it will be reported as 1 to 5. Now, let's look at an example of one response here. So you can see that A is here in this response, A is extremely greater than F. Okay. And then F is greater than, extremely greater than or important than C. Now, using the transitive property, it also means that A has to be extremely greater than C. Whereas the response here says C is greater than A, which is a contradiction, or in AHP's term, it's an inconsistent response. Then let's look at this one. Here, it says A is extremely important than T, and C is only just important than T. It also implies that A is better than C indirectly, but the response here says A is equal to C, which is again kind of indirectly inconsistent. Okay, and then there's another response here. So if you look at here, well, A is greater than F, F is greater than C, then C is greater than C, and yeah, which makes sense. F is greater than C, C is greater than D, then F has to be greater than D. So this is one of the correct and consistent response, but it's human mind, and so not all the responses that we get in the HP are consistent. So and so we have to identify, or we have to calculate the consistency ratio for each and every response. And I'm not going to run you through the whole process, but this is what I had on the slide. But you can go through these. These slides will be presented, share that on the Google Drive. So anyways, you find the consistency ratio for each of the response, and ideally the consistency ratio has to be less than 0.1, which is considered as consistency. So, and again, this is just the whole process that we followed for our analysis purpose, starting from criteria to the sub-criteria, how to assign weights. And I will quickly demonstrate you and how this works. So for example, let's say we have these 4 criteria, we use this scale of 1 to 5. Let's say for the 4 criteria, we generate the weights, and essentially affordability has a higher weight of 0.3. That essentially means it's the most preferred option for the users. Okay, accommodation is 0.19, That means that's the least preferred option. Now that's for the main criteria, level 1 criteria. Then when we go to the sub criteria, again, note that we have 12 sub criteria. I'm just showing 4 here. And each of the sub criteria also has a parent criteria, the level 1 criteria. So we generate the weights for each of the sub criteria, and we take the parent criteria weights here, and then calculate the global weight. Again, we can use these global weights for the sub criteria to rank them. Again, remember that we have to, in this case, our purpose is to rank or identify what are the priorities. Yes.
Sorry to interrupt, my friend, but we need to wrap up. We've got 5 minutes left.
Yes. Okay. I will just go through the results directly. Anyways, and we follow the same process, and we find different strategies, and that's how we try to find what good strategy was. This was just a demonstration. Again, that's the Python library we used. Here are some of the results. When it comes to the level 1 criteria, we found that availability is one of the major concern, or that's the priority for the general end users of transportation services. That some statistics about the resources, not all the results were consistent. That also means that we had to drop some results, but then we did a kind of check across all consistency ratio and different consistency ratio. And we also found that although the weights changes, the rank of these 4 criteria doesn't change. So which is good. That also means that we can still rely on all of the responses from this survey. We also try to check, okay, these are what the community members think, what's the priority. But when we look at the agencies, if you see the highest priority from the agency is the accumulation, and availability is the second. Affordability is the least concern for the agency. Whereas that's.
I'm sorry. We need to get to conclusions because now we've got 3 minutes for questions, please.
Yeah. So conclusion. Essentially, yeah. At the end, we just for our region, for the transit operators that are present here or operate there, we identified that shared dispatch and pooling and sharing and combining trips would be the better option for us to proceed. Okay, I will conclude there itself.
All right, very good. Abhay, look, sorry to rush you, but I do want to wrap this up on time and give everybody a chance. Do we have any questions from the general audience? I'll note while people are thinking of their questions, Christina's put a note in the chat. Anyone seeking PDHs, there's the form and everything there. Let's see, Viktesh has a quick question right there. I don't know if you can read it, Abhay, in the chart, or the chart in the chat. Talking about the AHP, can you elaborate on how it was created, the AHP flowchart? And how can we be sure that we didn't miss any element?
Well, to answer your question, I mean, AHP is a standard process. I mean, there's a lot of literature out there. There are the standard levels. Now, it all depends. For us, ideally, we would like to, at a level 1, we would like to add like 6 A's. But if you're looking at it from the survey perspective, you also want to get a good quality response. Right? If you're asking them too many questions, too many comparisons to make, that might not give you accurate answers, accurate responses. So it's kind of very hard to say, like, where exactly you draw a line, like how much criteria or sub-criteria you should have or not have. Again, if let's say it was academic exercise, we all researchers know how to deal with surveys and those stuff, then probably I would have done like a comprehensive AHP framework. But when it comes to the general public, rural community, old people, I don't think we want to make it easier for them. So the focus here is more on the quality rather than the quantity.
Thank you. Any questions for Dr. Evangelos? I have one quick one. Uh, so when I see the project that you did, it's three different universities, three different focus areas around trucking and freight and that sort of thing. Because this is we're wrapping up the year. This is we're a consortium. We work together. Do you have any just quick observations on the good things and the challenges about coordinating three different projects, similar projects across the universities?
Very interesting, very good question, Stephen. Yes, it was challenging because we try to find out what is the common of these three. Okay, these three research can connect with each other. We found it through the to improve the efficiency. Okay, the efficiency, and would be much better, I think, if we have these case studies in the same state, okay, to see the results, okay, see the results. But we spread it like that, okay, with the potential to be able, if you can see the future, to see how we can improve, how we can apply this to the same state.
Exactly. And that's something that I would like to talk to the three schools on later on, because I think there's an interesting tech transfer lessons learned there that are specific to UTCs, right? I mean, that doesn't, a single PI university or single university project is a different animal than the UTC. So I think there's some lessons learned there. And Ali, I think that's something we can get some mileage of going forward.
That's exactly, especially regional UTC, and then hopefully the lessons, at least within the region, hopefully can be adopted to a great degree. Yeah, I agree.
Yeah, absolutely. Well, listen, thanks everyone for being here. Thanks, Abai. Thanks, Evangelos. Good talks. Again, we're wrapping up this year with presenting the research that's going on at the center. We're moving into another year of research projects and moving things. You hear me, Ali? Moving things towards deployment and pilot, because that's what we're going to do. I hope everybody has a great long holiday weekend and that your summer gets off to a good start. And like I said, be on the lookout